The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, everybody, and welcome to Question Lab. I'm your host, Jeff Downing, and tonight we are going to send up a set of questions related to pharmacology. So get your pharmaceutical mind in gear, and we are going to get ready to have at it. And tonight I'm joined again by Dr. Paris Vicaria. Paris, would you like to introduce yourself to the crowd tonight?
Absolutely. Thank you, Jeff. Hey guys, my name is Paris. I'm currently in dermatology working, and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare you all for the USMLE Step 1, Step 2 CK, as well as your own individual school and other types of exams. I'm happy to help lead tonight's session.
This is a little bit kind of like a coaching session, but the main thing for us is that we want to make sure that you are developing good habits and that you have a method for answering these board style questions. Okay, so with that, let us go and begin with question number 1. Okay, so we're gonna for anyone who is new here, and let us know in the question box if you if this is your first time here. You're going to notice something as we reveal the question. You're going to say, "Well, wait a minute, I don't see any answer choices here." Okay, that's by design. When we really want you to be taking these step style questions in a stepwise process. So what we do is, first thing is, we cover up those answer choices. And the reason is we don't want you to get distracted or potentially disoriented by an answer choice that you're not familiar with. So if you see a word, a term, a disease, a bug that you're like, wait a minute, I didn't study that. That can throw you off your game. So what we do is we cover it up. And then we start by reading the lead-in. Now, the lead-in within these questions is the actual question itself. So in this case, the lead-in is the drug that was most likely prescribed affects cholesterol metabolism by which of the following mechanisms? Okay, so we read that lead-in. Now you have a sense of what it is you're looking for when you go into the vignette. If you start by reading the vignette, you may get into the story and you may try to lock in on a few details, but by reading the lead-in, now you can go back and read that vignette with a better sense of, hey, what are the triggers here, or what are the perhaps some of the key items that I need to focus on. Okay, so that is our process for tonight. So we read that lead-in. Now let's read the vignette. A 45-year-old man comes to the office for a routine examination. Due to his lipid profile, therapy with a lipid-lowering medication is initiated. The patient is advised that this medication may be associated with muscle pain and liver toxicity. So again, the question, the drug that was most likely prescribed affects cholesterol metabolism by which of the following mechanisms? So think about that question. Think about what you were looking at there in the vignette. Let us know in the question box how many steps you think it will take to reach that answer. You think it's a 1-step, 2-step, 3-step question? And with that, I will turn it over to Paris.
Thank you, Jeff. So what we're going to do is we're going to go ahead and show you what we think are the most likely clues in this vignette and the lead-in. Okay, so starting off, we are doing pharmacology questions, but we see there's a little bit of a clinical question here, and that's how the step examiners and question writers are really trying to focus their questions, adding a clinical component to even some of the basic science topics. So we see here that this is a 45-year-old man. Okay, so you want to make note of those demographics right off the bat. A lot of times that'll clue you in as to kind of what's going on with the question, what kind of things to start thinking about, so you don't want to miss that. Now in this case, they kind of give us a couple other clues, okay? That therapy with a certain type of medication is started, and they tell us about some side effects of that medication. So obviously you can see where this question is going. The question is asking about the drug and how it affects cholesterol metabolism mechanistically, okay? So I think step one, we've got to figure out what is this drug, and then two, what is the mechanism of this medication and how it affects cholesterol metabolism, okay? So at least a two-step question here. So let's go ahead and let's take a look at those answer choices. And as you can see, we've got 5 answer choices there, okay? You can see that a lot of those answer choices are getting into the basics of pharmacology. And so when we work with students, we recommend that they actually, as they go through these answer choices, that they start at the bottom and work their way up to the top. So starting with answer choice E and working their way up to A. And the reason we do this is because a lot of times we'll see students who start at the top, they'll see something they like and they'll select it without going through all the choices. Sometimes, as a result, they'll get that question wrong. So we recommend doing it this way to prevent yourself from making that mistake and not bias yourself. So let's go ahead and let's do that now. E increases the apparent Michaelis-Menten constant of HMG-CoA reductase. D directly increases apparent dissociation constant for LDL receptors. C directly decreases the apparent dissociation constant of hepatic LDL cholesterol receptors. B decreases the maximum velocity of hepatic LDL cholesterol receptors. And A decreases the maximum velocity of HMG-CoA reductase. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds. And I'll go ahead and read a couple of those answer choices to you again. Answer choice E increases the apparent Michaelis-Menten constant for HMG-CoA reductase. Answer choice D directly increases apparent dissociation constant for LDL receptors, and C directly decreases the apparent dissociation constant of hepatic LDL cholesterol receptors.
Okay, everybody, we've got that. The poll is open, so go ahead and make your selection. That's a good one to start the evening, and I don't know. We've got about half of you have voted so far. It looks like it's a 2-horse race, so be interesting to see how this one turns out. Okay, give you a few more seconds before we go ahead and close that poll. Okay. Well, let's see. We've hit that 70% mark, so I'm going to go ahead and close that poll. And we'll share the results. So, majority of you went with answer choice A, decreasing the maximum velocity of HMG-CoA reductase, while about a quarter of you went with answer choice E, increasing the apparent Michaelis-Menten constant. Okay. Well, interesting. So let's go ahead and we're going to hide the results and share the correct answer. And the correct answer is E. So the second place vote getter is the correct answer, is the winner tonight. Okay, well, with that, obviously, we're going to need a little bit of remediation. So, Paris, tell us about this one.
Yeah, absolutely, Jeff. So let's talk about this first question, okay? So hopefully you guys picked up on that this medication that was being started were statins. Okay, statins are one of the best first-line treatments for hyperlipidemia. And one of the common side effects involves muscle pain or myalgias, myositis, as well as liver toxicity. Okay, so let's take a look at the next slide. And we'll take a look at our statins as in our lipid-lowering agents. And you can see there that HMG-CoA reductase inhibitors is kind of the formal name for what statins are, okay? You can see there on the far right those adverse effects, hepatotoxicity, myopathy. You can also see there under mechanism. It inhibits the conversion of HMG-CoA to mevalonate. It is an HMG-CoA reductase inhibitor. Okay, it is a reversible inhibitor. Okay, so if we take a look at one more slide, and the next slide, you can see there, this is a image of your Michaelis-Menten constant, as well as your Vmax in terms of your pharmacokinetics curve, and what happens in the setting of a competitive inhibitor. So the red line is kind of normal substrate and enzyme. You don't have anything there. The gray line is what happens if you've got a reversible competitor. You need more substrate to overcome that competitive inhibitor. Okay, competitive means it can be outcompeted, but it also competes with you as well. So you need more of the substrate to reach that Vmax. Okay, and as a result, that Km, as you can see there, that halfway point of that curve, moves further to the right. It increases. So the apparent Michaelis-Menten constant increases in the presence of a reversible competitive inhibitor, which is the case with statins. Okay, so hopefully that makes sense as to why E is the best answer. Let's go back and we'll take a look at the other answer choices for those who selected others. So answer choice D directly increases the apparent dissociation constant. That is not really a thing with how with statins and this type of pharmacology mechanism. So that's the case for both D and C. Answer choice B, we're not really changing the cholesterol receptors here. So the maximum velocity, Vmax, is still the same. We're using an inhibitor of the enzyme. We're not decreasing that Vmax because this is a competitive inhibitor. So you can reach Vmax, you just need a lot of substrate to do that. And so that would answer B, the answer for A. And again, B, we're not really affecting LDL receptors here. Okay, so great job with this first question.
Excellent, thank you, Par. So again, now we're warmed up. We're ready to take on some more pharm. Before we do that, I want to just note that I know we just wrapped up the Labor Day weekend. Maybe some of you were out traveling. Maybe some of you are still in the process of traveling. Regardless, any time that you're looking to study on the go, the RxBricks podcast is there for you. We've got over 150 episodes, and these are all audio versions of our RxBricks. So most of them about 15-20 minutes, covering key topics within medicine, and we continually hear from students who tell us how much they enjoy the ability to listen to good content on the go, whether they're hitting the gym or washing dishes or cleaning clothes, whatever they're doing, walking the dog. So if you don't subscribe, this is a perfect time to do that. Just go ahead and hit that link. We put it in the chat. And whether you use Spotify or Apple Music or whatever your podcast player of choice, it is available there. Okay, with that, let's go to question number 2. And once again, we've got those answer choices covered up, and we're going to start with the lead-in. Which of the following best describes the mechanism of action of the new medication? Okay, parse that question. Think about what it is that you're going to be looking for. Obviously, there's looks like has to be 2 medications, right? If one of these is new. So with that, let's read the vignette. A 45-year-old man comes to the office for a follow-up appointment. He has a history of hypertension, and despite treatment with hydrochlorothiazide, valsartan, and amlodipine, his blood pressure 3 weeks ago was 168/95. Today, his blood pressure is 160/90. He is prescribed a centrally acting medication for additional hypertension control, and is counseled on the importance of compliance because suddenly stopping this medication can cause a severe increase in blood pressure. So with that, which of the following best describes the mechanism of action of the new medication? Let us know down there in the question box how many steps you think it will take to solve this one as I turn it over to Pars. Pars?
Thank you, Jeff. So let's go ahead and take a look at what we think are the important clues in this vignette and lead-in, okay? So we've got a 45-year-old man, okay? And they're telling us a lot about hypertension, okay? What treatments he's on, what his blood pressure values what his blood pressure values are, and then also this new medication he's prescribed. And this is one of the ways they like to do this. They will tell you something about the drug, just like the last question, without telling you the name, okay? And you can see they gave us a couple clues there about that drug, didn't give us the name. So I think step number one, we've got to figure out what is the name of this drug, what drug is this, okay? And then two, what is the mechanism of action? So I think we've got a two-step question here. One, the drug, two, the mechanism. So let's go ahead and let's take a look at those answer choices. And once again, we will start at the bottom and work our way up to the top. E, inhibition of angiotensin converting enzyme. D, beta-1 adrenergic receptor antagonism. C, alpha-2 adrenergic receptor antagonism. B, alpha-2 adrenergic receptor agonism. And A, alpha-1 adrenergic receptor antagonism. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, very good. So we've got the poll launched. Which of the following best describes the mechanism of action of the new medication? Make your selection. Remember, we always encourage you to answer every question, both on during question lab and on test day. You're not going to be penalized for taking a shot in the dark. So don't leave any of them blank. Make sure you fill out everyone. Okay, let's see. We've got about half of you have voted. Looking at the polls so far, it's interesting. It's a pretty even spread. So this will be interesting to see how this one pans out. Well, we've gotten almost 70% of the vote, so let's go ahead and get ready to close that poll. Hustle in there and make your choice, and then I'm going to close it up. Okay, we're going to close that poll, and let's share the results. Okay, so we had 4 answer choices receiving double digits, almost 20% at least. Alpha-2 adrenergic receptor and agonism received the most votes, about a third of you, but no clear favorites for this one. So let's go ahead and hide those results and let us share the answer. And the correct answer is answer choice B. So got it right this one, at least in terms of the highest vote getter, alpha-2 adrenergic receptor agonism. If you didn't get it right, that's okay. You're here to learn. If you're going to get any of these answers wrong, this is the time to get them wrong, because Pars is going to explain how you're going to get it right next time. Pars?
Thank you, Jeff. Yes, absolutely. Let's go through this question. Okay. So the main thing to pick up on is this patient has resistant hypertension. Okay. So even though he's on 3 medications at max doses, still not getting control of blood pressure. Okay. And so they tell you about another medication they started. And the side effects that they're talking about are that if you suddenly stop the medication, it can cause a severe increase in blood pressure. Okay. So let's take a look at the next slide and let's see kind of what that might be talking about. These are actually talking about your alpha-2 agonists, like a lot of you guys selected, such as clonidine. Okay, it's used for hypertension, other things as well. If you have withdrawal symptoms from opiate withdrawal, And you can see there on the very far right under adverse effects, the very last one is rebound hypertension with abrupt cessation. So this is a medication where clinically, if you were to have a patient on this and wanted to stop them, you would need to be very thorough in explaining to them how to slowly titrate off this medication. You do not want them to stop it suddenly, because then their blood pressure could go even higher. Okay, and clonidine, as you can see there in the title, is an alpha-2 agonist. Okay, it is a centrally acting medication, and it works primarily in the brain to decrease sympathetic outflow. As a result, you get a little bit lower vascular resistance, decreased blood pressure, and that's what helps with blood pressure in these patients. So let's go back to our question and our answer choices. Hopefully you see why B is the right answer. Make sure you guys are always reading those answer choices very thoroughly, making sure that you're looking at alpha-2, alpha-1, and not mixing those up, not mixing up agonism with antagonism, okay? The other answer choices, E, is obviously getting at ACE inhibitors, and some of the other medications are getting also at other antihypertensives, except that those do not cause rebound hypertension with abrupt cessation. Okay, answer choice C is more of a red herring. There's not really a medication that does that, but A, D, and E are blood pressure medication mechanisms, but do not lead to or do not have this phenomenon. Okay, so great job with this question as well.
Yeah, definitely. This is there's a lot going on here, and again, there's a lot that you have to process there in a fairly short amount of time. So again, think about your methods, think about your how you step through this. So this is all really helpful guidance there. So thanks, Paris. We're going to get to the next questions, and just to keep in mind, we do have a raffle at the end of tonight's session, so stick around for that if you want to get a chance to win. We've talked about RX Coach, and for those that ask about it and kind of wonder, well, what's the difference? What differentiates RX Coach from other tutoring services? Well, the main thing for us is that we are built, from the the structure that brought you first aid, right? I mean, we've been in this for over 30 years, with folks that really care about helping students succeed on exam day. And obviously, step 1, step 2 CK, these are huge exams. There's a lot that goes into them, but you may be preparing for CBSEs, you may be preparing for your med school exams. Regardless, we want to make sure that you're ready. So what we do is we start by giving you a 160 question assessment. And based on the results of that assessment, we were able to develop a personalized study plan. And it's one that we work on with you, right? So that, it's, no good if, you're looking at it and you're thinking that you're strong in renal, when it turns out, maybe that's a problem area for you. We really want you to be aware of where your strengths are, where you may have some challenges, and we pair you up with one of our RX certified tutors. So it's a one-on-one session. You'd be working with someone like Paris, who is going to be asking you questions and helping you improve your game. And on top of that, you do get access to all of the core USMLE-Rx tools, including RX 360 Plus, which includes the bricks. So, again, if you're at that point where you're thinking, I'm interested, I'd like to learn more, go to rx-coach.com. We've put that in the chat for you. You can set up a free consult, and during that consult, you can we'll tell you about the program. You can ask us some questions about it, and we'll see if it's a good fit for you. So again, rx-coach.com, and we'll look forward to helping you achieve your dreams. So with that, I'm going to go to our next question. So again, we've got 4 questions. This is question number 3, and we've covered up those answer choices, and we're ready to read that lead in. The new medication that increased the risk for the patient's gastric findings has which of the following mechanisms of action? Let's read that vignette. A 60-year-old man comes to his primary care physician because of abdominal pain and dark stools for the past 3 days. He has a history of gout and osteoarthritis that is managed with allopurinol and ibuprofen as needed. 2 weeks ago, he was given a different medication to use for a short period to control a flare of gout. Abdominal examination reveals mild epigastric tenderness. Stool is heme positive. Upper gastrointestinal endoscopy reveals hyperemia of the gastric mucosa and the presence of numerous linear ulcerations with evidence of bleeding. So again, the question, the new medication that increased the risk for the patient's gastric findings has which of the following mechanisms of action? There's a lot going on here. Let us know, how many steps do you think this question will require to find the right answer as I turn it over to Pars.
Thank you, Jeff. So what we're going to do is once again go ahead and show you what we think are those important clues in this vignette and lead-in. You can see we've got a little bit of a longer question here. Okay, we've got a 60-year-old male, and he's having abdominal pain and dark stools for the past 3 days. Abdominal pain and dark stools is what we call the presenting signs and symptoms. That's what brought him in to be seen. Okay. They also tell us exactly how long it's been going on for. We can see it's been going on for the past 3 days. So a little bit of an acute issue. Okay. They tell us about his past medical history, his past or current medications he's taking, and then also about this other medication. Okay. So you want to make note of all that. You want to make note of the following physical exam findings that they tell us about. They tell us about some endoscopy findings that are abnormal. So definitely want to use those and pick up on those clues. Okay. So they're asking us about this new medication, and specifically its mechanism of action. Okay. But they're asking us about the new medication that increased the risk for the gastric findings. Okay, so we don't want to make a mistake and forget maybe which new medication they're asking about. Okay, so let's go ahead. I think one, we've got to figure out what is that new medication, and then 2, what is the mechanism of action? So I think we've got another 2-step question here. Okay, so let's go ahead and let's take a look at those answer choices. Once again, starting at the bottom, working our way up to the top. E, inhibition of xanthine oxidase. D, inhibition of the sodium potassium ATPase pump. C, inhibition of the proton potassium ATPase pump. B, inhibition of beta tubulin polymerization into microtubules. And A, binding and activation of intracellular receptors. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, everybody, the poll has been launched. Go ahead and take your best shot. What do you think that mechanism of action is, or mechanisms of action that new medication increase the risk for? Let's see, we've got about half of you have voted. Taking a look at the early results. We've got one, not a clear leader here, but we've got about 4 of those choices that have double digits in terms of respondents. Let's see, we've got about 2/3 of you have voted so far. I'll give you a few more seconds. go ahead and make that selection before I close the poll in 3, 2, 1. Okay, the poll is closed. Let's share those results. And again, answer choice B, inhibition of beta tubulin polymerization into microtubules, was the leading vote getter. But answer choices C and E were pretty close in terms of second place. So let's go ahead and we'll hide those results and we will reveal the answer. And the answer is answer choice A, binding and activation of intracellular receptors. So that was the fourth place vote getter. So that was a tricky one. Let's figure out what happened on this one, Pars.
Thank you, Jeff. Yes, definitely a tough question. Okay, so let's go ahead and let's take a look at what's going on. This patient has some hyperemia of the gastric mucosa with some ulcerations. Okay, so we would kind of describe that as inflammation of the gastric tissue, aka gastritis. Okay, on top of that, there's some blood, as we can see with the heme positive stool. Okay, so gastritis and peptic ulcer disease, kind of what we're thinking is going on here. Okay. Now, gastritis may be induced by NSAIDs. Okay, this patient was taking ibuprofen as needed. Okay, however, remember they were asking us about a new medication. The new medication he was given 2 weeks ago to use for a short period. Okay, to control a flare of gout. Okay, and what that's likely getting at is actually glucocorticoids, which are sometimes used for severe arthritis or gout flares. Okay. Now, taking steroids or corticosteroids along with NSAIDs increases the risk of gastritis because glucocorticoids can also not be very comforting on your gastric mucosa. Okay. So the new medication that was started was most likely glucocorticoids, which also increased the risk of NSAID-induced GI side effects. Okay. So then we need to ask ourselves, what's the mechanism of glucocorticoids? And those are drugs that bind and activate receptors, glucocorticoid receptors inside the cell, intracellular glucocorticoid receptors. Okay, so let's go ahead and let's take a look at the next slide. And this is essentially how steroid hormones and glucocorticoids work. Okay, they bind to intracellular receptors. Okay, so it's an intracellular mechanism. So that's why answer choice A is the best answer. So let's go back and take a look at that. We'll talk about some of the other answer choices that were highly selected. So E is talking about allopurinol. Allopurinol does not really increase the risk of GI bleeds. And again, you know, that was a medication he was already on, not this new medication. Answer choice D, that's describing the mechanism of digoxin, which is more used for heart failure and in heart conditions. C is talking about proton pump inhibitors, which one is not really working to treat joint pain, and two would actually potentially help with decreasing reflux and acidity. Answer choice B, which I believe was the most highly selected answer, is getting at colchicine, which can be used to treat gout. Okay, it does not cause or increase the risk for gastric bleeds. Okay, it can cause you to have diarrhea, potentially hepatotoxicity. Okay, but you are not at an increased risk of gastric bleeds with colchicine, which is what answer choice B was getting at. So definitely a tough question here.
Well, that you know, again, there's a lot that you guys have to parse in questions like this. So this is a great one to really kind of test yourself with. So with that, we're going to go ahead and get ready for our final question of the night. Before we do, I just want to note that if you're looking for a study planner, we have a free one, one that will work for step 1 or now step 2. It's not. It says your personalized roadmap to USMLE step 1 to success, but we also have a version there for those preparing for step 2. Again, this is it's free. It's really a great tool. Tens of thousands of med students have used it to date. And the nice thing is that it's really kind of built around your schedule. You're the one who determines how much time you're spending each day answering questions or doing your reviews or working out, right? And then as you go in and you populate it with what you're going to be studying day by day, the tool adapts responsively and will help make sure that you're focusing on the areas that you need to focus on. So again, if you're looking for a really handy tool, which is again designed for the boards, but it's definitely something that can be used for other exams, whether it's even for if you've got an NBME coming up or like we said earlier, CBSE. It can be used for any variety of purposes, and it's all aligned with first aid. So definitely check that out. And with that, let's go ahead and pose question number 4. This is the final question of the night. It's a short one, so let's see if we can close on a high note. Answer choices are covered up, again, by design, and we'll read that lead in first. Which of the following best describes the effect of the prescribed drug on vascular smooth muscle cells? Think about what kind of information you're going to be looking for from the vignette as we read. A 65-year-old man comes to the office with dyspnea and increasing pedal edema. He has pulmonary crackles and an S3 heart sound. He is started on furosemide in metoprolol and is prescribed an agent that reduces his serum angiotensin II and aldosterone levels. So again, which of the following best describes the effect of the prescribed drug on vascular smooth muscle cells? Let us know down there in the chat how many steps you think it'll take to solve this one as I pass the baton to Paras.
Thank you, Jeff. So, this is kind of our 4th time doing this where we're showing you what we think are the important clues in these questions. And so, hopefully you're starting to get a sense of what are those important clues in both the vignette and the things you don't want to miss in the lead-in that can help get you to answer these pharmacology questions, okay? Now you can see we've got an elderly gentleman, a 65-year-old male, who's got dyspnea and pedal edema, okay? So a little bit more of a cardiac question. They tell us about, some abnormal physical exam findings, and then also 3 medications he has started on: furosemide, metoprolol, and another agent. Again, they're not telling us the name, okay? But they're telling us what it does. And so they are then asking us to describe the effect of that drug on vascular smooth muscle cells, okay? So I think we've got a 2-step question here. I think 1, we've got to figure out what is that prescribed drug, and then 2, what is its effect on vascular smooth muscle? So I think a nice 2-step question here. So let's go ahead, let's take a look at those answer choices. Answer choice E, increased activity of protein kinase C. D, increased activity of phospholipase C. C, increased activity of adenylate cyclase. B, decreased activity of phospholipase C. And A, decreased activity of adenylate cyclase. And you can see this is a really good example of how they had a very clinical question. But when you look at these answer choices, you can see at its root, it's more of a basic science, pharmacology, physiology type question, okay? So we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Okay, very good. Thank you, Paris. The poll has been launched. Paris makes a an important point there. This is kind of going back to basics a little bit, but you need to be able to apply this, within the context of a clinical question here. So that's a good question. There's a lot there's a lot for you to weigh as you get into this. Let's see. Well, about a third of you have voted so far. No clear favorite yet has emerged. Looks like every answer choice is getting some votes, so this should be interesting. Again, we're going to have a raffle here at the end of tonight's event. Somebody is going to walk away with a subscription to RX 360 Plus. Okay, about 60% of you have voted. Everybody needs to answer this last one. Come on, guys. It's no you don't want to sit on your hands here for question number 4. Go ahead and take your shot. Okay, well, it looks like about 70% of you have voted. So let's go ahead and close that poll. And we will share the results. Okay. So, boy, this is a real even split here. Answers A and B tied for first there, garnering 24% of the vote, with increased activity of adenylate cyclase right on their heels at 21%. And answer choice D got quite a few votes too. So again, I think there was a little bit of confusion on this one. Maybe a little more challenging than we may have expected. So let's go ahead and reveal the answer. And the answer choice is answer choice B. So again, about a quarter of you got that one right. Decreased activity of phospholipase C. Everyone else, well, there's something we're gonna have to figure out. So Paris, see if you can help us out.
Yeah, absolutely, Jeff. Definitely another tough pharmacology type question. So let's take a look at what's going on. So like I said, step number 1, kind of figuring out what is that medication, okay? So, hopefully you guys picked up that this patient is probably having heart failure, okay? Pulmonary crackles and S3, okay? And your main pharmacotherapy for heart failure usually consists of a few things, okay? So as you can see there in that vignette, this patient was started on furosemide and metoprolol already, okay? Another common medication that they start for heart failure are ACE inhibitors, okay? And ACE inhibitors reduce aldosterone levels, and they also block the conversion as a result of angiotensin 1 to angiotensin 2, okay? So if we take a look at the next slide, what we'll see is the signaling pathways of endocrine hormones, okay? And you can see there your IP3 pathway. Some of the hormones that use that pathway include angiotensin 2. And angiotensin 2, as we talked about, is now reduced in the presence of this medication, ACE inhibitors, okay? So you would have reduced IP3. And the way that this does this is by ACE inhibitors bind to angiotensin receptor type 1, which is a GQ protein that activates phospholipase C. So ACE inhibitors decrease that. So ACE inhibitors decrease GQ activation. As a result, you have decreased phospholipase C. As a result, you have decreased IP3. Okay, so your angiotensin 2 works via your IP3 pathway. So as a result, you can imagine an ACE inhibitor would decrease this pathway, which is activated by phospholipase C. Okay, so let's go back to our question. We'll take a look at the other answer choices. Hopefully you see now why B is the correct answer. Answer choice E, protein kinase C is activated by DAG, which is another byproduct of IP3. So we wouldn't expect that to be the case. D, as we talked about, is the opposite of our correct answer. Adenylate cyclase is coupled to GS protein, so a little bit different than what we're dealing with here. So that kind of takes out answer choices C and A. So definitely some tough pharmacology questions. Great job on working through them together tonight. And I will pass it back to you, Jeff.
Excellent, thank you, Paris. And again, nice job, everybody. I know some of these questions were challenging. Maybe some of you, a little bit rusty in pharm, or really, this is there's a lot going on here. There's a lot that you're pulling in from, from multiple areas. So again, I think this hopefully this will be a session you can kind of look back on and pick up some of the tips so that you can have these in your back pocket going forward. Again, we've got all of our questions here. They come from Step 1 QMax, so you can screenshot the QIDs, and if you've got a Step 1 QMax or RX 360 Plus subscription, you can just plug any of these items into RX Search, and you'll be able to check them out, go a little bit deeper into the explanations, or you can actually go in and look at the relevant bricks or the relevant pages in first aid, or you could even look at some of the flashcards or express videos connected to them. We've got lots of tools here to help you review and remediate, so definitely check that out.